Today, I have Tracy Donegan on the Conscious Fertility Podcast. Now, Tracy originally midwife in Ireland, now living in Texas, and is a health coach and has a Fertility Mind app as well. Tracy and I have connected a couple of times. I don't know how many years ago, but once upon a time, Tracy connected with me and we had a pick brain session on photobiomodulation, a little of a laser light, and I loved her enthusiasm and interest. And just to show you that, there's influencers and there's experts and then there's expert influencers. I really have respect for you, Tracy, because we connected recently in August of 2024 in London, England. I was presenting and attending the Photobiomodulation 2024 conference in London. And there you were to learn more about photobiomodulation, low-level laser light therapy, and hanging out. We got to chat and break some bread together and really geek out. And I thought I wanted to talk to you more on our podcast because you have lots to share, especially around the mind-body side. And you have a personal story, and I just always find that is something that the listeners can relate to, connect to, and you've been through it, and you had to find ways to get through it. And so I thought your story would be important. And you have the medical background because you've delivered babies for a long time as a midwife. And so I just love that you've been on the side of pregnancy and birth, and now you're on the side of preconception, helping getting that baby inside, they call it the oven, right? So welcome to the Conscious Fertility Podcast, Tracy.
Thank you, Lorne. And yeah, great to connect. It's interesting with what I'm kind of learning now about the photobiomodulation therapy and fertility. It's really exciting. It's an exciting time to be involved in kind of fertility services. And so anyone out there is close to Lorne and you're having challenges getting that baby in the oven, go check out what Lorne's doing with various lasers and helping more women on the path to parenthood.
Perfect. Well, before I get some questions, I want to share, I went to kind of your website and podcast pages, and I saw your bio, and I kind of want to just introduce people to you. I gave you my personal, informal introduction, but just to let everybody know, and then we'll get to the questions. And my first one is going to be your story through your fertility journey. And I just want our listeners to know that Tracy is a midwife, as I mentioned, and she's dedicated and advocated for women's reproductive health for many years. She's a midwife and author of 6 books, and you have 2 apps out there, founder of 2 apps. And you've been instrumental in educating and empowering women through your comprehensive, holistic approach to reproductive health and parenting, which is why I was drawn to talk to you, your holistic approach. She has her own personal experience, and she's going to share about her heartbreak through unexplained infertility and premature ovarian failure, and then also the joy that eventually became apparent in her journey and what she discovered. She does have a master's in Mindfulness Studies, and she combines extensive knowledge of reproductive health with mindfulness practices to support women and partners throughout fertility challenges. And she's deeply committed to women's empowerment throughout their journey and to parenthood and beyond. And you now have a focus as well on photobiomodulation, emphasizing its benefits for reproductive health, fertility, and overall well-being. And as we mentioned, you were in Ireland, but now you're in Texas. So Tracy, one more time, welcome to the Conscious Fertility Podcast. And can you start with your journey? I'm really curious to hear your journey and what brought you to where you are today.
Yeah, so I guess like a lot of other women out there, I just thought that when the time was right to decide to have a baby, that it would happen. And it was actually before I was working in tech at the time. That was kind of where I started out. And just we assumed that the timing was right, and we said let's give it a year and see how it goes. And we gave it a year and practiced consistently, but it wasn't happening. It did happen, but just after the first year of consistent practice and starting to a little bit more looking at my diet and lifestyle. But again, I figured I would be one of the healthy women that I don't need to do all of those lifestyle changes. And I just thought I was special. Well, it turns out it wasn't. We started off, unfortunately, with a miscarriage when it finally happened for us. So that was about a year later. And of course, again, like many of your viewers, I had been, on contraceptive pill for many, many years and really had no great understanding of that impact on my body. And I think we're seeing these days a little bit more intentional focus in that area on what these different medications can do to our fertility. So we decided we thought maybe it's time to get some treatment and go talk to somebody. So I talked to so I was referred to a gynae who had a fertility practice as well, and we did all the blood work and everything looked good. So we were given this really horrible diagnosis of unexplained. So, and for anyone out there who has had this diagnosis, it just leaves you reeling, because you almost want them to find a problem. It's like, if we find a problem, then we can, get a cure, we can fix it, we can get medication, we can do whatever we need to do. But being told it's unexplained was just unacceptable. So we thought, okay, let's start with the least intervention. So we went and we tried IUI. We did 3 rounds of IUI.
Intrauterine insemination, where they inseminate the sperm into your uterus. Were those medicated or non-medicated IUIs?
Unmedicated. Oh, sorry. When you say medicated, as in with Clomid, yes.
Like letrozole or Clomid?
Clomid, yeah.
So 3... you did Clomid plus intrauterine insemination, 3 of those cycles. Okay.
Yeah, no joy. So we were at a point where we thought, do we take the next step and go on and look into more intervention or more help? We weren't really sure. So I did speak with another kind of fertility therapist at a clinic in Palo Alto, and they kind of introduced me to, what we can do here. And that was a bit of a shock. The thoughts of all the medications and really, as we say in Ireland, fiddling with my fertility even more through medication. I just wanted to, I guess, pause for a bit and think about, okay, is this really where we're headed now? Or do we want to just leave it be for a little bit? Because both of our careers were taking off. Is this even a good time now to be planning a baby?
And when you say all these medications, so they went from the ovulation drug Clomid to suggesting the injectables in, like a super ovulation or even IVF? Is that?
Yeah.
And that can be daunting. How old were you at this time when you started doing the ovulation drugs with IUIs?
That was 28.
So unexplained and reproductive very young then too, for the population that we normally see.
Yeah. So I figured my age was on my side. Everything I thought was really on my side. So I thought, okay, so is there anything that I can do again on my own without going down the injectables and starting this treatment cycle so quickly? Because the first clinic that I visited really was pushing IVF quite quickly. And I really felt at that time, I was like, I wanted to pause. I wanted to just, can we go and have a look at, let's try some of the acupuncture. Let's look at the holistic aspects, because at that point in my life, really holism and women's health, I think, was not part of my mindset or my knowledge base.
You were in tech. You weren't even a midwife then, I take it.
No.
I'm thinking as a practitioner here, how old was your husband at the time?
Actually, he's 4 years younger than me.
So again, age didn't sound like it's a contributing factor. There's something else going on here. So you started looking holistically. So acupuncture, diet. I'm really curious because I don't know your whole story actually. So I'm really curious all the things you did.
Yeah, so I started looking at, okay, so what can I do to manage my stress a little better? So I thought, well, I think I had acupuncture in the past for a shoulder injury, and I thought that was really relaxing. So let's try that. And and again, this was the time before the internet was really a thing. So you'd have to go to the library, to look up a lot of information or to find good information on, okay, well, does it work? That's all you're thinking. Does it work? Will it get me pregnant? So I started with, I can't even remember now. It is so long ago what kind of Chinese herbs I was given, but this quite pungent,
this stinky, tasty tea. Okay.
Tea that I was quite happy to take, I thought, and part of it was, although, I definitely wanted a baby, I was like, it seems like there's a lot of extra stuff that I have to start doing now. And I have to start looking after my health. And that was such a again, when you're young and healthy, you think you're invincible and you automatically assume that, yeah, of course I'm healthy and well. But, growing up Irish, our diet was not fantastic. Our level of alcohol consumption in the early days was probably, these days would be, I'm sure, quite frowned upon, especially as, Irish people tend to start drinking alcohol quite early in our lives as well. So I felt that the IVF was being pushed too quickly. So I thought, let's pause. Let's kind of give me some time to, get together and from a, physical standpoint. So loved the acupuncture. I absolutely loved it. And I did acupuncture for probably about 6 months. And at that point, we thought, well, let's do it for 6 months. I had lots of really great massage. So I thought massage is always, for me, is a great way to release stress. So I thought I'll do more massage. Started getting out, getting more daylight, started looking at my diet, not in a way that was obsessive, but I looked at, okay, let's knock a little bit of the junk food on the head. Let's just reduce it a little bit and kind of let's see where this takes us. So we were at a point where it was 6 months later. I was like, because this is now a year and a half later. And of course, even though I was young, you hear that clock ticking quite loudly. Yeah. So at that point, then we thought, okay, so what do we do now? Are we going to go for IVF or not? And nature kind of made a decision for us, and we got pregnant without doing IVF, which right. I thought, okay, so what did we do? So we looked at stress levels, we looked at nutrition to a certain extent, but knowing what I know now, it's like there's probably a lot more I could have done, and supplements and things. But the acupuncture, I felt, was a kind of pivotal part of that, and making myself take time out of a really busy schedule, because what I find working with women who are, again, very career focused, very career driven, is that one of the questions I will ask is, what can you let go of to make room for this baby in your life? Because when we're trying to work 50 hours a day and get ahead and get the promotion, it's like, where is this baby going to fit into this picture? And for me, that was, okay, so what can I really kind of drop so that I can actually make the head space for this baby and heart space as well.
Make some room, that receptivity. So
yeah.
You shared a lot about letting go and making space and the stress. Now, like fast forward, you have 2 children, right? Was the second one conceived easily then, or did you also have to do some work, by the way?
No, at that point we had traveled quite a bit. We were living in Singapore. We came back to Ireland and we thought, this is a really good time maybe to expand our family. And we thought, well, my son Jack is here, healthy and well. Let's just, again, start practicing and see where it takes us. So we started practicing again. And I thought, well, look, based on our previous experience, it's probably not going to happen immediately. So let's just leave it alone. But not dissimilar to our first experience, I found myself pregnant a couple of months after we really seriously started trying, and had another miscarriage. So it's like, okay, well, I can get pregnant. What's going on that we can't hold on to it? So again, I figured, let's give it another couple of months. And at this point now, the clock is definitely ticking. So we're back in Ireland, so new care providers and new ways of doing everything. So eventually I got to have, get some blood work done, and came back saying, oh, did you know that you're in premature ovarian failure? Is there any history of early menopause in your family? I never heard anything like this before. So I talked to my mom, and she said, oh yeah, I went through menopause at 37.
So if you're having premature ovarian failure, then they would have seen it in your FSH. That would be one of the markers. And then through family history, your mom told you she went into early menopause. Okay.
Yeah. So I'm like, well, that would have been helpful information to know. And it just turned out, yes, I was in early menopause, and my younger sister, again, someone who didn't know the family history, found herself in similar circumstances. It would have been nice to know that earlier, but we didn't.
Yeah. So our listeners, if your mother's alive and you're talking to your mother, it's worthwhile to have that information of how old was she when she had her kids, and when did she go into menopause, because that would be good information to share with your fertility provider. Because, Trace, we've seen people like you come into my practice where they come in, they say they're unexplained, and then I ask them the question, do you know when your mother went into menopause? Some know, some tell me on the follow-up appointment. And we've had people come in, oh, my mom at 39, right? And they're seeing me at 35. And in those cases, I often would encourage IVF cycle to bank embryos, because we know if they have the elevated FSH or they have a low AMH, right, anti-Mullerian hormone, antral follicle count, if we see an ovarian reserve issue, it becomes a strategy to have a child or more than one child, because they're at greater risk of going into menopause earlier. And so there's where IVF becomes a tool or a strategy to have a family. right? Even though they
Yeah.
may still be able to conceive naturally like you did, it's a strategy to have more than one child and also to not have time as the thing that stops you from having a child. You found out then that you have a family history of early menopause. And so your younger sister, did she also have like high FSH? Did she go and get tested and find out her story?
She did, and they have like one child, and didn't go on to have any more. And they were at a point they were kind of happy enough with that. But I think again, if my sister had known this earlier on, she might have started her journey to parenthood a bit sooner as well. So I think that information really is so helpful. So we decided then, I looked at IVF in Ireland, and we were talking about like donor eggs, and for me that felt like it was a step too far.
And in Canada, the clinic I work with here, like we work go on site at Olive to do the IVF acupuncture on site, and we have a great relationship to talk openly with their reproductive endocrinologist. If you were in your early 30s then at this time?
This was mid-30s, yeah.
If you're mid 30s, I don't know what your FSH was, but if it was elevated and you know you have a family member early menopause, obviously donor egg is brought up because the elevated FSH may mean you may not respond to the drugs. But if you have the AMH is there, if they see antral follicle counts, they're still likely that they would, there would be a discussion, and they definitely wouldn't jump to the donor egg. They would probably go for at least an FSH to see how you respond, to see if you can make embryos with your own. And obviously, if you can't respond, then they know based on your FSH, your family history, then donor egg may be the next best option. But I just find here that as donor eggs are definitely used here, but it's not like a knee-jerk response to you should do donor egg. They usually exhaust you doing what you can do with your own eggs first. That's just my experience here. I do know other clinics like your experience where it's just right away to donor eggs. That must have been stressful though. You had a child on your own. You just discovered you have early menopause in your family. You get this diagnosis, premature ovarian failure. Just hearing those three words is like crazy. And then they're telling you donor eggs. So a little bit of a shell shock for you, or were you okay with that?
Yeah, well, the donor egg thing was a little bit of a shock for me, but we were also, again, is it gonna really, really kind of, upset us if we have one child, and we're glad that we have one child, and we can focus on enjoying one child. But when they mentioned donor eggs, for me, I thought that was too invasive, and it was also at a time when in Ireland in particular there was a lot of new clinics that were popping up in Eastern Europe that were offering very affordable packages to go to Eastern Europe and have have some of your treatments in Ireland, have some of your treatments, go to your IVF in Eastern Europe. And I thought, oh, this is, it's getting out of hand. I just want to, if we're supposed to have another child, we're going to have another child. And kind of that was where I was at. And financially, it just, trips to Europe and everything was just not gonna happen. We had just moved back from Singapore to Ireland and had, like all the things you do when, you buy a house and, you have expenses, and we're kind of looking at how can we make the best of this situation? So we said we leave it be. I started in my midwifery training, and a year into my midwifery training, I found myself pregnant with Cooper. So that was a 7-year gap. So 7 years, we were hoping it'll happen. And because I didn't even have cycles. I had like the odd period. There was, we felt it was over, but touch wood, I have to say my experience of menopause was very, very easy.
But you conceived your second child 7 years apart. And in that period, you found out you had high FSH, your mother had early menopause, and your cycles started becoming absent and irregular, sounded like? You weren't having
Totally.
Gives hope to some people too, right? That it can still happen. And that's why
Yeah.
I want to talk to you now about, because I think the listeners like, so what do you do? Like, what can you do? Because of, your work with mindfulness, your study, you've done extra studying in this to be credentialed, and you've come up with an app. I will let our listeners know. I'm going to ask you about stress and fertility, because that seems to be an angle that you're quite passionate about and like to talk about. But just on a side, Tracy has this app, and it's the Fertile Mind app. And for those that come to AccuBalance, you can let us know, because she's given us access so we can play these for you in the trim room, so you can get a sense if you like it. And you can also go ahead for any of our listeners and download the Fertile Mind app and get those meditations that she's made around fertility. And I think you said the coupon code for those people, if they want to save, will be AccuBalance. So thank you for that.
Sure.
Let's talk about stress and fertility then. What's your take on how stress can impact fertility, and what's the strategy you have to help mitigate the effects of stress?
Well, I guess, and I know you're well aware of Alice Domar's work and the big question, does fertility challenges cause stress? Which absolutely, but does stress actually cause fertility challenges? So we're looking at it from different angles. And I guess for me, the mindfulness aspect is recognizing that so much of the stress that we all experience, even outside of fertility challenges, is self-generated by the thoughts that we entertain. And I know, like, when I talk about mindfulness, people say, well, you can't just choose your thoughts. These emotions, they just pop up. You can't choose your thoughts initially, but you can decide how much attention you're going to give those thoughts and those feelings. So you wake up in the morning and you're thinking it's not happening. Things I'm never going to become a mom. That you recognize that these kinds of thoughts are going to take us into a stress response, and we're generating that stress response more frequently the longer we spend in that thought pattern of, I'll never be a mom. Things never work out for me. I'll never be happy until I have a baby. And and it becomes this cycle of this habit of thought. So until you recognize that, especially when you're dealing with fertility issues, that is an ongoing kind of chronic thought pattern that we have. It's never going to happen. I'm not that lucky, works for everybody else. IVF won't work for me, whatever that thought pattern is. And I would say just spend a couple of moments throughout the day noticing, where did your mind go to that took you to that stress response? Because the brain has these kind of default behaviors that are, protective, evolutionary. So the brain will focus automatically on worst case scenario. It's drawn to worst case scenario. It's drawn to drama because it's a protective mechanism. So if 100,000 years ago we were out hunting and gathering and we heard a rustling in the bushes, the brain automatically thinks tiger, not hamster. Now, could be a hamster, but you're taking a chance evolutionary if you think, oh, I'm going to assume it's a hamster, and it turns out to be a tiger. So for all the brain is focused on is, how do we get our genes into the next generation? How do we, propagate? How do we continue the human being, cycle on this planet? So through the stress response, we're creating more inflammation in the body. We are suppressing oxytocin. We're suppressing all the hormones that we need to support fertility when we're stuck in this chronic thought pattern of, it won't happen for me. And then our mind wandering is that second default, is that the mind wanders to stressful thoughts. It doesn't want, when we're stressed, we don't automatically think of sitting on the beach, getting some sun. We think about worst case scenario. So that mind wandering and the negativity bias, the focus on worst case scenario, just derails our, healthy thinking and keeps us in that stress response much more frequently. And we think it's innocuous, that it's just stress, but stressful thoughts don't stay in your head. They impact everything that's happening in the body. So I think we're at a point now in research that we can recognize that the mind and body are intricately linked and we can't separate them. And then we look at the number of women who are already experiencing anxiety and depression, other psychiatric illnesses, even before they step in the door of a clinic. And what the research shows without a doubt, that when we can learn how to regulate our emotions more, we're more likely to continue with treatments. So we're more likely to manage those really difficult days with a little bit more self-compassion, which, again, once we introduce self-compassion practices, which is just a way of being kind to ourselves and not beating ourselves up. Fertility is not our fault. These fertility challenges are not we didn't cause this. And it's so easy to get drawn into those thoughts of, oh, if I hadn't have, drank so much tequila when I was 20, or, that we're looking for ways to really, beat ourselves up. So that recognition of, we have to treat ourselves a little bit more kindly, because the brain cannot tell the difference between something you're vividly imagining and something you're actually experiencing. So if we're walking down the street and someone shouts abuse at you, you're going to respond in a physiological way. Your stress hormones are going to be released. But if you are walking down the street and you are berating yourself or, beating yourself up, again, the brain is going to act as if that is an assault on ourselves. So it will react in the same way. So we're not talking about monitoring our thoughts, just starting to notice them. Be curious about where your mind goes when you're not looking.
And so just to kind of unpack that and summarize what you said, you gave a shout out to Alice Domar. She has a podcast episode with us, number 39, Does Stress Cause Infertility, for those that are interested, because she's done research at Harvard. And Stephen Porges' episode 45, The Polyvagal Theory and Brain Connection, is on the Conscious Fertility Podcast. And this connects to what you're saying, because he talks about a state of alarm. And so what I heard is if you're in this negative thought process, your body goes into a state of alarm, and then it goes from that parasympathetic to sympathetic survival mode. And then you talked about the stress hormones that are released. So rather than doing dopamine, oxytocin, serotonin, and good blood flow, you go into a stress response, an alarm, and now the body diverts blood from the reproductive system, digestion, into survival, your heart, your lungs, major muscles. And now you're releasing cortisol and epinephrine, and you're releasing these stress hormones, which in short bursts are okay. But if we have it all day long walking down the street, it creates chronic inflammation, which leads to many diseases, including premature fertility decline. And so being curious and kind, we can retrain our subconscious, our mind, to not be an alarm and to keep engaging the parasympathetic. Because so often the negative thought's not a survival benefit. Like, if there's a tiger there, that's a really good example. If there's a wild tiger, not a hamster, it's good to have the stress response. It's evolutionary. If your parents didn't have a good stress response, your ancestors, those that had a good stress response are here today. Those that did not have a good stress response are not here today. Those that thought, it's just a hamster, did not survive. So we're not saying you shouldn't have it. It's just that if you're worried about work, if you're worried about the IVF cycle, all these things which are understandable why you would stress about it. However, from the physiological perspective, there's no survival benefit. But your body's releasing those chemicals for survival. And if you're having those several times a day, every day, it wreaks havoc on the body. And the mind body, a lot of the research, they call it psychoneuroimmunology, PNI. And I've heard people add an E to it. So psychoneuroendocrine immunology, which means what you just said so elegantly, Tracy, is your thoughts and your thinking impacts your nervous system, impacts your immune system, and now we know endocrine, your hormonal system. And my goodness, your nervous system, your immune system, your hormonal system, that's your reproductive, going to have an impact on your reproductive system. So for those that are wondering, does stress impact your fertility and you want the data, listen to episode 39 with Alice Domar, listen to episode 45 with Stephen Porges, and listen to all our episodes because we usually bring it up. So I think the evidence of the mind and body connections there, mind body, it's not mind and body, you can't separate them. So what led you to create these apps, and kind of how are you working with your clients then? What are you doing with them from the mind body aspect? And are you bringing in nutrition and supplements? Are you doing, I know you're passionate about laser. I'm curious your integrative approach, what you're doing when you work with clients, and a little bit more about your approach for stress reduction.
So as part of my, when I did my master's, my dissertation was actually on the effectiveness of mind-body interventions, specifically mindfulness interventions on psychological distress. So it was a really good opportunity for me to kind of wrap my arms around, like, what does the current research show? Like because, there's lots of there's CBT, there's different therapies out there, counseling. But I wanted to see, okay, look, if I'm focused on mindfulness as a kind of therapeutic intervention that women and their partners can do at home, is it actually going to help? So the research came back that was fairly clear that it helps specifically dealing with that, distress that often comes with, a failed IVF or the lack of hope and shame and grief. There's so many emotional aspects to this journey. And for anyone who has been out there and who's been told, just go and relax, take a holiday, and mindfulness is not a relaxation technique. Relaxation is a side effect of it, because when you start to be curious about where you become, what I say, the nosy neighbor of your mind. when you start paying attention to where your mind is going on a regular basis, you then have that awareness that you can, okay, well, we're not going to spend so much time on that train of thought because it's just not good for me, not good for my reproductive health. So let's pull back and let's redirect our attention. But for me, when I was creating this app, I have another app called Gentle Birth, which was I designed because there was so much fear around labor and birth. So I developed a program that included mindfulness and hypnosis and breathing techniques for women going through pregnancy. But what was happening was I was having so many like women who had used the Gentle Birth app coming back to me saying, I loved using it for my labor, but we've been trying for a while now. It's not happening. Is there anything that you have that's like Gentle Birth that can help me like with my mind and stop me kind of going off the deep end so frequently? So that was really where the idea came from. It was like, okay, how can we create a program that will cultivate hope, will cultivate optimism, and help these people manage their mind a little bit, but with no guarantees. Because there wasn't aspect, and I know I'm sure you're well aware of this, the snake oil part of fertility treatments of, women pushed all these miracle cures being pushed that, this will get you pregnant. And it's, some of the things that you will see online these days are just ludicrous, no evidence based. And it's really just taking advantage of people like myself who are in a vulnerable state. And if you can afford all of these, what we think might be the final piece of the puzzle, you will spend good money on it. But I wanted to create a program that didn't have any guarantees. It's not, I can't tell you if you're going to get pregnant or not. And what happens if you can't? So what happens if you've done the IVF or you've exhausted all treatment and it's not happening? What that emotional landscape look like for those people? So for me, it was, let's create a program that cultivates hope, optimism, and joy during this journey, but without making promises, and knowing that all of these practices that you're going to do, on a regular basis using the app will be a benefit to your mental and emotional health with or without a baby.
Yeah, that's what I call true success, that they're going to be okay. And the conscious fertility work that I do, and I mentioned the podcast in the early episodes, that's kind of the intention of this conscious work. So your app has that same goal of whether you have baby or not, you're better through the process and you're okay. Your desire is still there. You're disappointed, but you're not paralyzed by it. So
Yeah.
that's great. And obviously, if you get into that safe mode, that should increase your chances of getting pregnant because you're getting more into the parasympathetic. So do you still have because if things are, if people have babies that are working with us, they're going to be pregnant and they're going to have birth. Are your pregnancy and birth apps still available as well? Can people still, because, we're always about getting you right to the birth. When you get pregnant, like different from an IVF clinic, natural fertility clinic at AcuBalance, and like you do, where we're different is you don't graduate at 6 weeks. You're pregnant, see you later. Our goal is birth. So we work with our patients right up to birth and postpartum, because we're here for healthy baby, healthy mom, and if they have a partner, healthy partner, right? So we continue to work throughout the pregnancy. And that's also because the health blueprint of that child is based on the health of the mother and father, the sperm and egg, I should say, to be more accurate, health of the sperm and egg at the time of fertilization, and then the health of the baby throughout the pregnancy, right? Doesn't start at birth. You would know this as the midwife very clearly. So that's a long-winded way of me asking, do you still have those apps available for pregnancy and birth? Because I'd love to let our patients that become pregnant know about them, and those that just come to us for pregnancy support. Do they exist?
Yeah, it's so my pregnancy, birth, and postpartum, which is of course the piece that everyone forgets about and that needs the most emotional kind of regulation. It's Gentle Birth is the name of that app.
So after you've gone through the Fertile Mind app and you're pregnant, know that there's another one for Gentle Birth. I want to talk about preconception care from your perspective. I always find that you have better insight, different insight, but better insight if you know the end in mind, if you come from that experience. And so because you've worked with pregnancy and birth, you're on the end of what everybody's doing with fertility treatments. How has that shaped you with respect to preconception care versus like go right into an ovulation drug cycle or IVF, or go in trying to conceive while you may have endometriosis or PCOS? Like, can you tell me, from somebody who works in the fertility field now, but somebody who's had experience with birth and pregnancy, what's your thoughts on preconception? And how long should it be in
Oh,
general?
oh, it's huge. It is, I mean, we're looking at creating the cells that will then create, and our body, yeah, as a mom, is going to create the building blocks of this baby. So preconception care is absolutely huge, but it's, unfortunately, we have, about 50% of pregnancies are thought to be unplanned. So we have a lot of women coming into pregnancy who may not be coming into pregnancy in the best of health. And we're in this health crisis here in the US at the moment with, we have like 50% of the population being, either diabetic or pre-diabetic. We have a huge metabolic syndrome like issue in the US at the moment. But for me, that preconception care is, I mean, I will look at kind of, the bigger picture, and stress levels is always a big part of that, because even, and it's this paradox of even women who have been through IVF and have had a successful IVF or successful treatment, if they haven't gotten mental health support, and not many clinics actually offer mental health support, or really screen moms or screen women coming into their treatments to look at what their baseline is of mental health, that those women will, unfortunately, but half of those women will take that anxiety and depression into the pregnancy, even though they have we cut the golden goose here. We've now achieved pregnancy. And we know that anxiety and depression in pregnancy is associated with higher blood glucose levels. We know blood sugars in early pregnancy is associated with higher rates of miscarriage, birth defects. So it starts, again, as I would say, I would love to be working with someone at least 6 months before they really kind of had plans. So we can look at their nutrition. We definitely want to look at their light exposure, which again, I'm sure is a normal part of your work. But most of the women and partners that I talk to have never had any information provided them about the dangers and the harms of blue light, that light that we're sitting under for like 90% of the day, if not even more. So light is and light consumption and light nutrition is a kind of big part of my approach now, and that's only in, I'd say, the last year since I've learned more about how damaging the blue wavelengths are.
And not getting the good light in the morning. I got Huberman's podcast on light really changed my thinking around that. Hence, I get up early in the morning and go and
Mm,
do my walk for that early light, even with cloud. And if you
yeah.
remember when we were jet lagged in London together, I was making sure right away I got early light and stayed up late to get the dark. So, get the serotonin going in the morning and get the melatonin going at night, and stayed away from when I woke up at 3 in the morning in London, I made sure I didn't look at my phone or anything just to help with the rhythm. So yeah, light's important,
Yeah.
which makes me want to ask you, so preconception care, it's important. And as you, so next we're going to talk about photobiomodulation, but the preconception care, I just like to summarize for our listeners and to make sure I get it. You're saying like 3 to 6 months. And that's because the egg and sperm cell that mature, the lifespan, the follicular genesis, it's about 100 days, where there's a lot of impact on the environment. If the environment that the egg is maturing in can impact, it reaches peak fertility potential. Goes through recruitment for about a year, but those last 100 days seem to be important. The guy's 72 to 90 days. And on a tangent here, talking to a reproductive urologist, Paul Turek, we have an episode with him as well. He had shown that when he does a varicocele repair, so surgery for the varicose veins in the testes, where it affects motility and count, theoretically 3 months later you should see the sperm better, because they actually know they repaired it. It's gone. Like, sometimes it takes us
Mm,
several months to change a metabolic disorder or change inflammation, but right there the cause is gone, right? In a sense, the
yeah.
blockage. He says it usually takes 2 cycles of spermogenesis to see a change. So it can be up to 6 months after the change. So just to let people know, that's why 3 to 6 months is reasonable for preconception care. And a lot of people will be doing that while they're doing things like ovulation drugs, trying naturally, or IVF. You talked about light. You invested a lot of time and money to come out to London, because that was not a cheap trip for us,
Mm.
was it? The travel was there,
No.
the hotel, the cost of
Yeah.
eating in London, and the cost of that
Hmm.
conference, and time away from our family and our clients. Although we had a blast and we learned lots, right?
Absolutely.
What kind of has attracted you in photobiomodulation in preconception care that got you to go on a plane and go to London for 4 days to be at this conference?
I think you cannot work in this this field without being aware of how light can be beneficial or harmful. And we're looking at, metabolism and how unhealthy, unfortunately, the population of in the US is at the moment. And we're seeing fertility rates drop. It's like, what is going on what has changed, in the last 20 years that we're seeing fertility drop off so much. So we're looking at, okay, what are people eating? There's a kind of a big push on at the moment on seed oils and getting back to eating real food. But even, we look at, someone that says, I eat organic as much as possible, and I eat, kind of a low carb diet, and I've gotten rid of all the processed foods. That even, for anyone they're really conscious about what they're eating and they're eating organic, even like our soil is so depleted. And then even by the time that it takes for that food to travel across the country, we have depleted the nutritional status even more. So for me, it was like we've got to get the diet right. And the light was just another part of it. It's like our lifestyle keep us under this blue lighting for like 90% of the time. So we're not getting out in the sun. We're not getting our vitamin D. We're not getting the UV. We're not getting that really helpful near infrared. Like our bodies are starved for light. And even like the World Health Organization has, come out and said that, artificial light at night is a carcinogenic. So we've got to start looking at when I first heard about the idea of light and reproductive health, I thought it was just some new fad and it'll be gone in a couple of months. But the more I looked into it and the more research that I saw, and then talking to Anne-Marie in Denmark and yourself, and it's like, no,
You're talking about Anne-Marie Jensen, who talks a lot about fertility and photobiomodulation.
In Denmark. Yeah. So it was for me, it was becoming more and more obvious that, we are light starved. We did not evolve to have no light in our eyes and on our skin. So for me, that seemed like it was a really important pillar that was being missed. So the chance to go to London and hear you speak and connect with the scientists, which one aspect of the conference that I really enjoyed was it wasn't, yes, there was a really nice exhibit hall, but most of the presentations were from scientists with no skin in the game. They weren't trying to flog a product. They were there saying, this is the data. We think it's really helpful. Now, there's a lot of data, more data that we need, but when we look at it from a metabolic standpoint and the reduction or modulation of inflammation and looking at what it's doing for pain and for people experiencing like long COVID. And I felt like, this is really, why isn't this mainstream? And of course, we know why it's not mainstream.
There's not a lot of money to be made in it.
Exactly. Yeah. So for me, light was really a big part of it. And then exercise and stress management, absolutely, as well.
And so for you, then, this is something that you're incorporating in your practice, then, the photobiomodulation with respect to fertility.
Yeah. So at the moment where I'm at is I will do consults with that, because some people just want to know about the light and they're doing their own thing when it comes to nutrition and lifestyle adaptations. So I do consults for light based on if people are looking to buy, consumer products. But consumer products, you can go on Amazon and there is like 2 million different products that we have no idea if they've been third-party tested, if the light is even the wavelength that it says it is.
Were you in that session? So there was a session about home systems, and what they shared is there are some that are good, but the majority of them don't do what they say they do, as in they don't have the power, the wavelength, the radiance. So it's really hard right now for any of us to know if what they say is what they can do with respect to photons. Unfortunately, there are some out there that are high quality. There really are, that do what they say, and you could benefit from them. The majority of them at the time of this recording are not. And this was based on one of the publications that was presented where they looked at systems and tested them, and they did not have the parameters of wavelength and irradiance and power that they stated and claimed, because there's no regulation to do that. That's why the professional ones also can have some of those issues. And that's why there's a few professional lines that we look at. You and I have been talking that we at least know that they have the data and they're reporting their data, so we can confidently use their equipment, knowing that it's doing what it says it does.
Yeah. And I mean, the power of the unit itself. And you just see like there's so much misinformation and lack of understanding about the different products and because like my own kind of journey into light over a year ago was all I could see out there was, oh, I got to get a panel. I have to get one of these big tall panels and that'll fix everything. And then as I learned more, I thought, oh, okay, the panel is great if you have, I think systemic issues or for, post exercise. And I thought, but as I look more at the research, so much of that light is lost just through the distance from the light. So it's like how much we want to get good power, but we also closer to the skin, the better. And then we're looking at EMFs and now the research is showing that, again, closer to the skin and even compression on the skin is reduces that scatter. And then the different wavelengths, blue, green, near infrared, red, what's the best wavelength for the condition that we're trying to treat? So it is definitely becoming a much more refined science. But at the moment, it's like when we look at the research, absolutely for musculoskeletal, for pain, wound healing, it is absolutely fantastic.
Brain health,
Brain health.
Parkinson's, we saw the
Yeah.
Parkinson's and the concussions. Those are
Yes.
great.
Yeah.
Were you at there was one I was at where they were placing it on the sternum. I always liked the sternum because of Michael Hamlin's research that he shared on stem cell proliferation. I don't know if it was his research or what he presented on when he shared, but I can't remember her name now. I'll have to look at the program, but they did the thymus, so the sternum to impact the thymus and impact melatonin as well, metabolites and stuff. So again, like you said, it was so cool to see the scientists, what they're doing with different lights and based on where you place it. So it's not just, so personally, for my fertility patients, I'm not a fan of the panels yet. Like you said, maybe some systemic because it's good for some maybe inflammation, definitely the skin. But when you're getting into stem cell proliferation, viral immune health, getting into the mitochondria of the cells, I don't know. That's why we have the Bioflex systems, we have the paramedic system, the Giga laser. I like the Giga because of Anne-Marie Jensen. We mentioned her a couple times. She's episode 78, by the way, all on photobiomodulation, just because she's been really diligent at documenting and collecting her data and publishing her data. It's not what we'd call, it's not a rigor of research, but she's sharing case studies, and she has well over 200 case studies showing very optimistic success rates using this system called the Giga laser. So I like it because at this point in time, based on her data, that system seems to be working well for those that have reproductive health issues. And other systems you could do it or maybe do better. It's just that she's published her data and eventually we'll get more research. That was, as you remember, my talk was, here's the mechanism. The mechanism, we got the science. We're so excited about the mechanism. We have some research, some very poorly done, but we have some research. And now it's like, can we translate this to clinical? Can we do more research? And Anne-Marie right now just has a lot of data, as does Nakamura out of Japan that he shared with me. He has his data of case studies. So we're in that direction, but robust evidence is not there to say this is what it will do for you, but the mechanism is there. We just don't know if it translates into clinical. And that's a long way of saying, so when somebody says which one, I'm like, well, right now, Giga, I like, and I'm saying there's other systems, yes, but I like it because of what Anne-Marie has reported. If it's real, then I like it. No reason to say it's not, but more reason to say we need to do research now based on her approach with that system. The panels, I'm not convinced. And most of the panels, again, do they go through the rigor of testing to see that they're offering what they are? And you mentioned so much gets reflected and bounces off when it's not on the skin. So again, it comes down to, we just got to study it rather than thinking, maybe it does, maybe it doesn't. Does the system do what it does, as in power and wavelength? And then two is, we just got to do research to find out that does it change certain pathologies in the body? More research. And we're seeing that with musculoskeletal. We're seeing it with Parkinson's and the microbiome. That's why I like the Giga as well, because it covers not only over the abdomen, the ovaries, but over the microbiome. So I figured that's probably one of the benefits to that system, helping the microbiome. But so you have a passion for photobiomodulation, which means you and I will be chatting lots more, right? Because I usually like
we definitely will, because I am we're hoping to have another giga in Texas soon. So it's, and I've been kind of chatting to kind of women in this community, and yeah, there's this system is not available here in Austin where I am. So it's like and I know you have people that are flying to use your giga laser, and I've talked to people who are willing to drive from San Antonio and other places and Houston to come and use it as well. So it's
Yeah, well, people that will come and do it 3 or 4 times in that week in the follicular, they're out of town.
Mhm.
If they're local, then they do 2 or 3 times during their follicular a week. That's what Anne Marie has shared: 6 times a cycle for 3 cycles, up to 3 to 6 cycles. So the first 2 weeks in the follicular. Check out Anne Marie's podcast on that for those that are listening, episode number 78. And I want you guys to check out Tracy's website and her apps, because she's got some really cool stuff to offer you. So she has, as we mentioned, the Gentle Birth app is available for those pregnant and ready to birth. And then those that are on their fertility journey, the Fertile Mind app, fertilemind.app. Is that the website then?
Yep.
Okay. We'll put that in the show notes. We have that at the clinic. So if you want to hear some of the mindfulness meditations to help calm the mind and the nervous system, then let us know. We'll put that on for you. And then if you want to download your own version to have it to use at home, go to the fertilemind.app. And Tracy said that she'll give people a discount if you use coupon AccuBalance. And AccuBalance is spelled with 1 C. It's not like accounting. Accounting's with 2 C's, but AccuBalance as an acupuncture. So thank you for offering that discount.
Yeah, and it'll give them 30 days free, so they can get in and kick the tires, and especially if they have a cycle coming up that they're going to need a little bit of help on and
Well, that's
manage the
really
mind a little
generous. 30
better.
days free. That's even, I wasn't sure what best
That's a
discount you
good
can
discount. Yeah.
get. So that's great. That's really kind of you. And hope to have you back on our show again to hear more of the things that you're into. And I'm sure our travels will cross over again as we tend to join these photobiomodulation conferences and fertility conferences.
Yeah, looking forward to it.
Thanks. And I look forward to showing up. I know I'm going to be on one of your YouTube shows as well. So I look forward to
Yes. Yeah, looking forward to it.